Hello, everybody. Great to see you and welcome back to the Cat Project Echo. Thanks for sharing your lunch hour with us in the midst of very busy days. It's wonderful to see you guys. And as you're coming in, as usual, go ahead and drop your name into the chat, what organization you're with, which county that you practice in. And then because we're talking about anxiety today, let's talk about our favorite stress busters. What are our go-tos when we're feeling that anxiety rising up within ourselves? And so I think, as you know, me, that I'm Joanne Chad. I'm with UCSF. I'm a German pediatrician. Clinically, I practice in San Francisco. My favorite stress buster probably is running out in nature. Just being in the woods is what calms me. I would love to hear from all of you, as you can drop some of this into the chat so we can see who's here with us today. And a couple of quick reminders. We know it's lunchtime. This is the virtual brown bag lunch. Please eat so that we can kind of so we see each other, so be a little bit more like a community, even though we're coming from all across the state. We're sitting in very different places. It's great just to be able to see each other, to connect with each other, especially as we're discussing the case. And speaking of cases, we do need one more case presenter for next month in June. And so we're going to be talking about SSRIs. So if somebody has a good case that involves a question around SSRIs, starting for the first time, or running into unexpected issues, anything related to that, please let me know if you've got a case to share, and I can tell you all the details about how that works, because this is all about all teach, all learn. We are learning from each other, as well as from our wonderful subject matter experts who are here. We are recording just the didactic portion of this, so just as a reminder of that, but the recording will turn off when we do our case discussions. And as another reminder, June will be the final meeting for this ECHO cohort. So this group will come to our last meeting in June, and when we talk about SSRIs. And that meeting will be happening on June 28th. Any questions here? Before we move on off of announcements and I go into introductions. Okay. So we're very lucky to have with us today Dr. Lauren Schumacher, Dr. Anna Swan. So Lauren Schumacher is one of our child and adolescent psychiatrists who works on the CAT portal, answering calls. She also helps to organize these continuing medical education activities, including these echoes and the webinars, with particular interests in ADHD and anxiety, among other topics. We also have Dr. Anna Swan, who was with CAT for a while as we were getting started and has since moved on to Lumate Health. Very lucky to have her back with us. She's a clinical psychologist with much expertise in the field of pediatric anxiety. And I think these wonderful multidisciplinary perspectives will be great for us to learn from today. With that, I'll turn this over to the two of you.
So here we just have some financial disclosures. I do have some stock holding options in my role as clinical director for Lumate Health, and then CAP also receives federal and state grant funding. So our aim for today is for you to come away understanding how to identify and diagnose anxiety disorders in primary care, to have an understanding of the evidence-based treatment options. We'll be talking both about therapy and medication, and also to have some resources to share with families. Next slide. So we wanted to start by acknowledging the impact that the COVID-19 pandemic had on mental health, and sort of part of the reason why many of us are probably here today. So 2.6 billion youth between 0 and 19 were affected by the pandemic. 1.5 billion youth across the globe were affected by school closures. And rates of anxiety were already on the rise pre-pandemic, and then the pandemic really just escalated the situation. And in a meta-analysis of over 80,000 children and teens across the globe, prevalence rates of depression and anxiety were shown to have doubled compared to their pre-pandemic estimates. So if you're seeing a lot more mental health concerns in primary care in your own clinical experience, you're not alone. This is sort of echoed worldwide. And in response to this, the U.S. Preventative Task Force recommended starting to screen for anxiety at age 8 a couple of years back, just in response to this ongoing youth mental health crisis. So hopefully we'll be able to give you some helpful tools today. Next slide. So we wanted to start with, what is anxiety? Anxiety is a human emotion that we all get to experience, and there are 3 main pieces to anxiety. The first is the feelings piece. Think that fight, flight, or freeze response. So for example, I have a test coming up, I have some butterflies in my stomach. Then there's the thinking piece. And so when we're feeling anxious, we're usually thinking ahead to bad stuff that might happen so we can prepare. So maybe in this test example, I'm thinking, I'm not sure I understand all the material. And then the third piece is the action piece. So anxiety is not a fun, comfortable feeling to have. We usually don't like experiencing anxiety. So typically we try to do something to get rid of it, most often to avoid whatever is making us feel nervous or to escape from the situation. So in this example, maybe I ask my friend or my teacher for help explaining that concept so I feel prepared for the test. So that's an example of how anxiety can be adaptive and actually a really useful feeling for us to have. That being said, there are definitely times when that anxiety alarm starts to go off so often and so loudly that it can become a problem. So we might take that same example. I have a test coming up and I feel like I'm going to throw up. My fight, flight, freeze response is on volume 10 out of 10. And I'm thinking I'm going to fail and maybe I'm not going to get into college. And then my action is I procrastinate. I don't study for the test because every time I look at it, I feel like I'm going to throw up. And then maybe I even miss school the next day because I'm so fearful about taking this test. And so here, that anxiety is happening at such a loud volume that it's gone from being a helpful adaptive emotion to starting to become problematic anxiety. And when I'm thinking about when does anxiety kind of meet criteria for an anxiety disorder, there are sort of 4 Ds that I think about. The first is dysfunction. So is this anxiety causing a problem in the youth's life? Is it holding them back from what they want to do or what they need to do at school, with friends? Is it causing problems in family life? The second is distress. So again, anxiety is not a fun feeling to have. And so if it's happening really often and really intensely, that can be very upsetting. The third is duration. So how long has this been going on for? It's really common to feel more anxious in that, first week of starting a new school, typical anxiety. But if this anxiety has been happening more intensely and more often for 3 or more months, then that usually indicates it's probably not going to just go away on its own. And then the fourth D is deviation from the developmental trajectory. And so really thinking about how this anxiety is presenting within the context of the youth's development. We expect to see stranger danger, for example, in a toddler, but if we're also seeing this elevated anxiety response meeting somebody new in a middle schooler, that indicates a different story. So those are kind of the 4 Ds to have in mind when you're wondering, is this kind of like typical expected anxiety, or is this potentially anxiety that's causing a problem and might meet criteria for an anxiety disorder? Next slide. So I wanted to share some quick facts about anxiety disorders. They're incredibly common. In fact, this is the most common concern in youth, with 3 in 10 meeting criteria for an anxiety disorder by age 18. At the same time, compared to other concerns like ADHD and behavioral difficulties, anxiety disorders are really often overlooked. A lot of times, these are not the kids who are causing behavioral difficulties in the classroom or at home. So they might even be kind of that straight A student, and so their distress gets unidentified. But also, anxiety is associated with impairment in academics and social functioning and family functioning. And so even though these kids might not get identified, they are really struggling and it's causing problems in their life. And we also know that once anxiety is problematic and it's meeting criteria for an anxiety disorder, a watch and wait approach is no longer appropriate. In fact, anxiety disorders typically just don't go away on their own. Kids typically don't age out of it. In fact, they usually kind of continue on into adulthood. And you can kind of think of it as this gateway disorder almost, where untreated anxiety can lead to the development of more problems over time, including other anxiety disorders or depression or substance use. So that's why we're all here, because primary care is such an amazing setting to be able to increase the identification of this often overlooked concern and also to facilitate increased access to care. Next slide. So on this slide, we have included some of the different types of anxiety disorders. Just for time, I'm not going to go into each of them in depth, but I want to point out that comorbidity really is the rule rather than the exception. So it's quite common for a youth to meet criteria for multiple anxiety disorders at the same time. This might be a teen that experiences social anxiety disorder and also a lot of generalized worries about school and health and the future and how they're doing. It's also common for sort of what anxiety looks like to change over the course of development. So for example, you might have a kid who, when they were younger, had a lot of separation anxiety concerns. They worried a lot about bad things happening to them or their caregivers when they were separated and had a hard time sleeping on their own. And then when they become a teenager and everybody is starting to care more what others think about, what their peers think about them, that sort of manifests more as social anxiety disorder. So if you're seeing that the families that you're working with are coming in with anxiety in lots of different ways, just know that that's actually quite common. And then I also wanted to highlight OCD, obsessive compulsive disorder. This is technically no longer an anxiety disorder in the DSM-5, but how we identify it and how we treat it is quite similar. And so I sort of think about it as on the spectrum of anxiety and related disorders. Next slide.
So there's some very helpful tools that can kind of assist in helping you identify anxiety disorders in kids. So if you're talking with a kid or family and you're kind of hearing some things that may be concerning for possible anxiety, using one of these questionnaires can be helpful to further characterize and get a sense of the severity of the anxiety disorder. So one we very commonly use is called the SCARED. It's validated for ages 8 to 18. And this one's nice because there's both a parent and self-report. So you can have the parent fill it out as well as the kid. And it assesses for a number of those different anxiety disorders. The main drawback is it has 41 questions, so it is a longer questionnaire. And then the GAD-7 is validated for ages 13 plus. This one just has a self-report, and it specifically looks at generalized anxiety disorder, but it's significantly shorter, so it can be helpful for with those older kids. It's a little, often easier to get them to do it. And we have those available at the CAP website. So I know we've been hearing a lot about some of the concerns about anxiety disorders, how they've been increasing. And there is, though, some good news that there are effective treatments for anxiety disorders. So when they're recognized, then we can help kids and get them into treatment. And according to the ACAP practice parameter, both SSRIs and psychosocial treatment are part of the clinical guidelines when treating anxiety disorders in youth. So you want to be both thinking about SSRI medication treatment as well as behavioral treatment. And we'll talk in more detail about those two now.
So the therapy that has the most evidence that in support of it as an effective treatment for youth anxiety disorders is cognitive behavioral therapy, or CBT. And so I'm going to explain a little bit more what this is, and then also some things to highlight if you're talking about CBT for families to help them connect with a qualified provider. So if we think back to sort of those three pieces of anxiety, there's the physiological, the feelings piece, the thinking piece, and the behavioral piece. CBT teaches youth and families tools and practices those tools to sort of target each corner of the triangle, because if we can shift one corner of the triangle, the rest of the triangle can shift too. And so to target that physical fight, flight, freeze response part of anxiety, a lot of times we'll work on, first of all, even being able to identify anxiety, and then some strategies like mindfulness or relaxation, really trying to target that activation in the sympathetic nervous system. To target that cognitive piece, the fact that when we are feeling nervous, we are more likely to think that bad things are going to happen, and also that we're not going to be able to handle it. We have lots of different strategies to help youth have a different relationship with those thoughts and get unstuck from that way of thinking about things. The fancy word for that is cognitive restructuring or cognitive reframing or even cognitive diffusion. Those are slightly different versions of how we do this. And then the real key ingredient to CBT for anxiety targets that behavioral piece. So when we're nervous, we want to avoid what makes us nervous, and we want to escape from the situation. And that really is what maintains the cycle of anxiety. And how we target that in treatment is through something that's called exposure. And it's so important that I have a whole slide on it. And then we also have some other tools that we might teach as well, some problem solving and distress tolerance to sort of be able to enter into those anxious situations rather than avoid or escape. Next slide. So CBT for anxiety has a real emphasis on exposures. This is the key ingredient. And I will say this is something that I recommend families ask about when they're looking for a provider, and really want to ask, is this provider comfortable doing exposures? Are they going to do exposures as part of session in addition to sort of assigning it as practice between session? I think some CBT providers are doing a lot of the cognitive piece, but they miss out. They're doing a lot of the C in CBT, but not a lot of the B in CBT. And so we really, this is the magic ingredient. And so it's very helpful to have a provider that is going to do the exposure work. And the reason for this is there are a lot of different reasons why a child or teen might be feeling anxious, but avoidance is the primary maintaining factor. So I'm feeling nervous, I avoid the situation, that leads to relief short term, but I miss out on the opportunity to learn how to handle the situation. Maybe it's better than I thought it was going to be, but I miss out on that opportunity. And so I continue to feel anxious. And so exposure therapy involves, as a team, collaboratively and creatively coming up with a step-by-step plan for how to practice in session and between session, actually doing the things that makes the youth feel nervous with a very supportive team, so they can practice facing fears and be able to kind of take their life back from anxiety and feel more confident doing what they want to do and what they need to do. Next slide. So here I also wanted to touch on parent involvement. So parents can play a huge role in helping their child to gradually face their fears. And there's no person in this kid's life that's more invested in wanting them to be able to take their life back from anxiety. And so on this slide, we have an acronym. We love an acronym in psychology to sort of help you remember what are some of the top things that parents can do to help their kid. And it spells out CARE, how to care for a child or teen with anxiety. So the C stands for being a coping model. So kids pick up on what they see from the people in their lives, including their caregivers. And so being a coping model is actually the parent themselves modeling for the child how they themselves recognize when they're feeling nervous and how they can use their own skills to manage that worry adaptively and take steps toward facing their own fears. It's not being what we might say an expert model of, just never feeling anxious and going through life on a cloud. It's actually modeling for the child how to effectively manage anxiety. The A stands for accommodate less. So I think oftentimes when we are thinking about accommodations, we're thinking about them as this really positive thing. Like in school, you might have accommodations in an IEP plan or a 504 plan to help a child access their learning. But in the world of anxiety, accommodation is defined as something that the family or the school or the system is doing to help the child avoid or escape from that anxiety-provoking situation. And while it is so understandable why we do this, why we rescue that child in distress with an accommodation, it is actually part of what keeps the anxiety going long term. And so the question that I think is helpful for parents to ask themselves if they're putting an accommodation in place is asking, is this accommodation supporting my child in taking a step toward this situation? So actually, is sort of having this in place helping them take a step on that ladder toward facing fears in a proactive, helpful way? Or is this accommodation really serving to help them escape or avoid the anxiety? Is it a reactive measure where it's just relieving the distress, but actually help sort of signaling that the child can't handle it on their own, or maybe even signaling that this is indeed a dangerous situation and that's why they had to be rescued from it? And this is hard to do. It's hard to sort of like gradually fade out those accommodations, especially if there's a more anxious and distressed kid who's feeling really fearful. So that's why, again, it's really this team effort between the therapist, the family, the PD, all the providers sort of coming together with the child as a team to figure out how are we going to make a plan that works. The R stands for reward brave behavior. So I love rewards. This can be, it's hard work to face fears. And so we really want to be giving a lot of positive praise and attention for when the youth is doing the hard work of facing their fears. This can be with label praise. That was so brave when you said hi. This can be a token system. You can have points and brave bucks, flying around, lots of fun. With teens, maybe they're getting access to special privileges because they're taking steps toward trying things out when they're nervous. Lots of different ways to reward brave behavior. And then the E stands for empathize and normalize. So how many times has somebody told you, don't worry about it, it's no big deal? And how many times has that actually been helpful? So telling a kid not to feel nervous when they're feeling nervous doesn't really do much. And then the opposite, it's getting more frustrated or punitive when they're avoiding things because they're nervous, similarly doesn't help. Instead, really getting on the kid's level, understanding what it is that's making them nervous, being empathetic, normalizing lots of people feel this way, and also sharing, signaling that, anxiety is a feeling that we all get. It's a safe feeling to have. It's a temporary feeling to have. So really having that balance of being both very empathetic and also very encouraging toward facing fears is what we're going for. Next slide.
So in addition to behavioral interventions, medication can also be helpful, or specifically with SSRIs can be helpful for treatment of anxiety. So the times when you want to think about starting medication for anxiety is if they've had limited improvement with therapy, if the anxiety is severe, such as a GAD-7/16, if the anxiety is so intense that the patient's unable to engage in the exposures that Anna was talking about, that are such an important part of a behavioral intervention. If they have a comorbid disorder that's requiring treatment, so if they have anxiety and depression, and it's helpful to keep in mind that while each CBT and SSRI medication alone significantly improve anxiety compared to placebo, the combination together is the most effective treatment. So there's kind of 3 medications that tend to be our go-tos for treatment of anxiety. They're all SSRIs, and they're sertraline, fluoxetine, and escitalopram. We tend to go to sertraline first, if all else being equal, for anxiety. And part of that is that was the medication that was used in the CAM study, which was a large randomized control trial that compared sertraline treatment versus CBT versus combined treatment. And it tends to be pretty well tolerated. The fluoxetine is the most activating of these 3. So it may be less good option for just anxiety alone, but it is has the longest half-life and is least likely to have discontinuation issues. So is a good option if there's concerns about the kid or teen consistently taking it, and also can be a good option with kind of the combination of anxiety and depression together. And then escitalopram is another option. It tends to be pretty well tolerated as well. If you note, none of these actually have FDA approval for treatment of anxiety disorders in youth. So it's all kind of off-label use, but there is good data to support their use. And next slide. And finally, here we have some resources for families. The handout includes some others. And I really like to recommend some of these books to families because especially this kind of helps address the situation that is unfortunately far too common when you may have identified that a youth has an anxiety disorder and you know they need behavioral treatment, and it can be really hard to get them linked with a therapist. But a lot of these books that are featured here actually kind of talk through the approach. So like What to Do When You Worry Too Much is a workbook for kids about anxiety, and it talks about different behavioral strategies that they can do. Helping Your Anxious Child is a book for parents, but it kind of basically talks through some of those strategies that parents can do and really how to help the parent help the kid kind of do their own exposures over time. So these can be great resources. And then Camp Copilot is actually an online kind of class that goes through CBT skills for parents and kids. And there's also more anxiety resources on our website.
Thanks so much, Lauren and Anna, for that great talk. A couple of questions did come through. One has to do with advising on social media use, especially in light of this recent Surgeon General statement about the potential harm that comes from social media use. So I'll let either one of you take this.
I feel like this is such a hot button topic. And I think it's helpful for parents to first understand what is so appealing about social media use for their child and understand about some of its benefits, sort of having that connection, having that community building. There are a lot of wonderful and great things. I think if parents kind of come in first just saying like, no, shut it down, it's going to backfire. So I think the most probably the most important thing is for families to be able to talk openly about this together and to sort of have times where you're using social media as a family, you're sort of, looking and seeing what's that TikTok video that you just watched? Oh, that's so cool. Oh, let me see your friend's post. So the family is also aware of sort of how this is coming up, and then can also kind of give some in the moment guidance if there are some things that are sort of coming across as problematic. But yeah, it's a hot button topic for a reason.
Thank you. The question has to do with defining the nuances between these related terms, anxiety, stress, and panic, right? And the specific example that was given here was about a preteen with some anxiety about the impending death of an aging family member or pet. And so can you walk through like how you might approach something like this?
Mm-hmm. So the metaphor that I'll often use is that you're on a boat and there's this storm. So if you're on the boat and you are weathering the storm right then and there, that's stress. So there's something that's happening in your life that is leading to this feeling and you are managing it. Anxiety is you went through this really scary storm, and then the next time it's time to go out onto the water, you're thinking about it and you're thinking to yourself, what if we have another storm? What if something bad happens? That's anxiety, is sort of thinking ahead to these bad things that might happen. And then a panic attack is kind of a neat, it's a defined thing where there's this sudden onset of a lot of physiological anxiety symptoms that happens really intensely and very quickly within sort of over a 15-minute time period. And so that's a panic attack. And you can have panic attacks that happen in a in a situation that triggers them, like if you have social anxiety, you have a panic attack because you're feeling really nervous in a social situation, or you have generalized anxiety and you're worrying about something and that triggers a panic attack. And then panic disorder is when you have a panic attack that happens out of the blue at least one time, and you're very worried about it happening again. So you're not in a scary situation, you're not thinking scary thoughts, but all of a sudden you have this intense rush of physiological symptoms. Yeah. And then I'm curious, so then I was wondering about the preteen with anxiety about the death of an aging family member or a dog. It sounds like this is kind of a realistic fear. This is something that's happening in this teen's life. This is not something that they're worried about, but is not occurring. Yeah. Yeah. So here, I mean, I think I would normalize a lot of this. I'd be curious about sort of how the family is talking about this. I'd be curious about how they're spending time with the family member or the pet whose life is coming to an end. So I think a lot of normalizing. And then I think sometimes if this like worry and anxiety is bleeding into lots of other areas of their life, like they're having a hard time focusing in school, or they're not able to have fun with their friends because they're so worried about this happening, sometimes it can be helpful to have sort of a discrete part of their day where they are really, sometimes we call it a worry time. They could do this on their own, or they could do this with their family, where they really are sort of having this compartmentalized time to think about what's bothering them and to talk it over with somebody, with the aim that hopefully, you know, they have this dedicated time to really face this incredibly difficult situation. And then when it pops up at other parts in their day, they know, like, I can enjoy this time with my friends, and I know I'm going to have this time later in my day, this worry time, where I'm going to feel supported and be able to talk through what I'm feeling with my mom or my dad, or even on my own.
Thank you so much. That's a great strategy. That's it for the questions. And thanks so much, Anna and Lauren, for this great talk. And we will be posting recordings, and we'll be sending out a handout to this group later.